The hair is the frame of the face. More than just an aesthetic feature, hair plays a crucial role in confidence and well-being. As hair loss becomes a concern for millions, demand for hair transplants continues to rise. But with so many options available, how do you choose the right doctor? We spoke with Dr. Bernardino Arocha, a board-certified expert in hair restoration, to understand what makes a successful hair transplant and why expertise matters.
What determines the value, of a hair transplant? You hear it all the time, competition based on price. You have to compare, like anything in life, apples to apples. In the field of hair restoration surgery, there's only 200 plus board uh, diplomates of the American Board of Hair Restoration Surgery in the whole world. So the vast number of hair restoration pro- providers are not really fellowship trained in hair surgery. Experience is a database of having done something. It's also an insurance against uh, in favor of it being done right. Hair and hair loss are inversely related. So it's always the patient that has the greatest needs that has the least amount to work with. And so you have to keep this in mind that you only have so much to do it right. And if it's done improperly, it's sometimes very difficult to correct. How do you increase the chance that you're going to get it done correctly? Look to the American Board or the International Board of Hair Restoration Surgery uh, to find a qualified, trained surgeon.
Hair transplants are both a science and an art. Beyond just restoring hair, a well-done procedure should look completely natural.
In my opinion, a hair transplant that looks like a hair transplant is a failure. The art of hair restoration surgery is in creating a result that's so natural that no one is going to detect that you had anything done. Most of my patients tell me that they get a lot of compliments, but people can't really put a finger on what they had done. They say, "You're looking younger, you're looking better. What is it you're doing? You working out? Have you lost weight? What is it that you've done?" When actually it's the hair. The hair's only hair, but it's very important because it's a frame to your face. It focuses the attention on your eyes, which should be the salient feature. It's very important in enhancing eye contact, whether you're talking to someone across a table or you're giving a talk to an audience. If your framing is good, you tend to attract more attention. People listen better. Like 90% of men with hair loss have a genetic hormonal cause of the hair loss. In women, it's 50%. 50% have genetic hormone, and the other 50% have scalp issues causing the hair loss. So it's always progressive and gets worse with time. So I always recommend to stabilize the loss with the non-surgical program in men, minoxidil, finasteride, PRP, and laser. And that can help to tip the scale in your favor that you're not going to continue losing hair. When it comes to lasers, I like to use the Extra Lux system uh, with more laser diodes, increasing the effective wavelength stimulation of the follicles.
Hair loss is a journey, but so is restoration. If you're ready to take the next step, choose a surgeon with the experience and skill to deliver natural, lasting results.